Thank you. So statistical illiteracy is not limited just to patients reading complex medical literature. In fact, it affects all stakeholders: patients, providers, researchers, the media, etc. And shared decision-making is fundamental to patient-centered care. So a lack of understanding of the numbers involved can undermine informed consent and clinical decision-making, and therefore harm patients. So you would think that medical journals would engage in a rigorous statistical review process and clearly and transparently report the results to benefit all involved stakeholders. In fact, no. The Lancet reported back in 1937 in an editorial that many of our problems are statistical. And almost 80 years later, Nature, Allison and colleagues reported a tragedy of errors, where in the literature we still have many statistical problems that affect reproducibility. We know that instructions and checklists for authors are not effective to address this problem. Recently, in 2013, Annals of Internal Medicine conducted a survey of their authors about their statistical review process. And of the authors surveyed, 64% of them noted that a considerable effort was involved to address the statistical reviews. And most of them commented that what they wanted most was more opportunities for communication with the statistical reviewer. We evaluated the statistical methods in published articles in the Journal of the American Veterinary Medical Association. And we found that for articles published 20 years ago, almost 50% of them largely had, or they only had, descriptive statistics and t-tests. Whereas for the articles published more recently, only 14% of articles had those simple descriptive statistics and t-tests. So as such, as has been found in the human literature, it's quite likely that readers don't comprehend the content of many articles. So in implementing a process of 100% statistical review in our journal back in 2013, what we wanted to do was emphasize communication and collaboration. And one of the most important things was an emphasis that it's not about who's right. Because in one of my favorite quotes from Maya Angelou, what I found is that people will forget what you said and people will forget what you did, but they don't forget how you made them feel. And I was able to assemble a really highly qualified group of biostatisticians to help me with this effort. And one of them, the preeminent statistician David Salzberg, in an early review, noted that one of the problems in the medical literature and with the statistical review process is that authors will do what he called, they'll decorate their articles with a statistical gloss, in that the statistics in the article are actually really not helping to address a question. And so what we found is that often the statistics, we were taking them out, so authors didn't really need sometimes the statistics in the article. So our authors have responded very well. These are some comments. For example, a statistical reviewer commented initially that the design was good, but the statistical analyses did not address the question. And after the author went through the statistical review process and they enlisted the help of a statistician, they published their raw data, they actually commented that they prefer a higher quality paper even if it took longer. And we've had this from a lot of authors. Similarly, another author commented that they were used to reviewers finding reasons to get rid of the paper, but obviously we're trying to help them get published. Now in a paper now that's in press and will be published in November of a randomized control trial that's being reported in accordance with CONSORT, the initial review listed all of these problems. This is verbatim from their review. And the reviewer commented, the methodological issues cannot be fixed. After 3 rounds of review, including by the statistician and by peer reviewers, the reviewer now states that this can serve as an importance of a high standards of reporting and an example of transparency in the literature. And what's more, the author commented that this has revealed much to them and they've been gratified by this process and they really have found it to be a positive. And importantly, when you read the article, the discussion goes into the limitations such that readers will be able to understand the findings in the context of those limitations. So quality and transparency of reporting are essential for patient-centered care. And most clinical studies in medicine are not perfect, but the results must be published. So we've found that authors do respond to a collaborative process. And rigorous statistical review can take time. A single comment can take a week of work. And statistical review is not a guarantee against error, but we feel that it's an essential component of ethical peer review and scholarly publication. Thank you.
This is really interesting work that you're doing as well, and thank you for bringing it to Medicine X. One of the things I wanted to ask you was that, do you think there's also a role to be played in, because it's very a structured process in how journal articles are written, and that's important, but because of that process, statistics, and you know, in my entire experience as a researcher and even running, I find most people don't understand the numbers, and even myself, if I haven't dealt with a particular type of statistical test for a while, I have to refresh you know, what it means. So do you think there's a better way that where we can actually communicate the information so that it is understandable even to reviewers? Yes,
I mean, I think that that's a good point, and that's something that we've been going through here. I think a lot of what we've been doing is we evolved from just, you know, the statisticians, is that we've gone through more comprehensive sort of methods review, what we call it. So a lot of times we're using basically the reporting guidelines and going through a step-by-step process using those. But I think, are you talking about communicating it to the lay public or to the physician audience?
Yeah, so there's a whole thing of, you know, this knowledge being locked up. I mean, in the same way that before the Gutenberg's Bible, you know, everything had to be in Latin, and it was on purposefully done like that to keep knowledge away from the general public. And we still have that issue with scientific journals, but there's yourself and a lot of the Medicine X community trying to change that. But even in the review process, because it is difficult to find people who actually even understand the statistics, and mistakes get made. I mean, the Lancet journal with the whole vaccination thing, I mean, that caused a huge amount of damage.
And that was one of the things I was getting at with that early thing where we surveyed the reader understanding of the statistical methods, because it's not just that patients, it's that we as doctors, veterinarians, we don't have enough education in statistics. So what we're trying to do is to increase that also. So I think that initially we just need to be more transparent. We do need more. At the beginning, what we need to do is we need to go to statisticians and have them help us and not expect to do it ourselves. We shouldn't, as editors, we shouldn't do it. We shouldn't, as regular peer reviewers, do it. And then the American Statistical Association and Sense About Science have an initiative to help educate the public and the media and lay public. And so that's one thing, but that's actually not aimed at journal articles. That's aimed at the lay, but I think that actually I've been talking with Annals of Internal Medicine and a friend here about how we might integrate that with, you know, medical literature too, because you're touching on something that I think is a bigger issue.
I mean, there's this big movement which started at Medicine X, I think, to have patients as part of the review process.
And I was at that yesterday.
It's so important.
Yes.
But maybe that's another thing. We need to, all the statisticians need to unite and
that's what
have a movement to get proper statistical analysis involved.
And that's kind of where I was at with this. It was hard in 5 minutes to sort of get into some of that.
I figure we got a couple of minutes. I'll just ask you a few questions.
No, and as I say, I actually met with my friends in Annals, and we're sort of part of that, what the ASA, and not anesthesiologists, but statisticians are doing, and Sense About Science, trying to just overall increase statistical literacy, which is not just patients, it's doctors, all of us, we all need it. So you're right, we need to improve it in the medical literature, but we need to improve it just overall in communicating in science. Because in those very first slides, when I talked about statistical illiteracy, it's sort of a global problem, in other words, it's not just doctors. And when you look at evidence-based medicine and statistical, you know, patient-centered care, if we can't understand the numbers, we're not helping, you know, that affects the whole, you know, decision-making process.
Yeah, absolutely.
Does that make sense?
Oh, it absolutely does. And look, thank you. Oh, look, we've got a question from the floor. And look at I've got time. Yep, let's get a question from the floor.
Hi, my name is Ofer, and I don't want to put you on the spot, but you know, there's 51 million surgeries in the US every year, okay? And most studies have, what, 30 to 300 patients? So isn't that like a joke that the studies are even meaningful? I mean, we have 51 million studies. Why don't we have more data on that?
So the question is, I'm not quite. So I apologize. I'm not quite understanding.
The question is simple. You know, the best statistics apply to a study that has 100 patients, and where the study has a big incentive to quote unquote succeed. You know, it's like what my grandmother used to tell me. There's three kind of lies. There's
Lies, damn lies, and statistics.
exactly, and you know, on the other hand, we have 51 million surgeries with no facts behind them. So why don't we start gathering those facts?
I think you're right, and I think that goes to the problem that a lot of times there's a poor design in the first place. That therefore, when authors are communicating their results, they need to communicate the results transparently so that people can understand the context. In other words, the results may not meaningfully inform practice if they're not representative of the population. So you're right, if it's a small, and I think that this is a problem in terms of reporting results transparently. And that's where I was getting at, for example, with that randomized control trial. That author has done a really good job of at least saying, and I wish I could have shown you that this is what we should have done, this is what we should have done, this is where there was bias, this is where this is, and we need much more transparency so that then at least the reader can decide, does this help me in the context of which I am practicing, or does it not? And we need much less research waste, because we shouldn't be conducting studies that are not valuable. But at the same time, if studies have been conducted and patients have been enrolled, those results need to be published, because otherwise those patients, I mean, we must publish studies that have been conducted, because negative results need to be published. Otherwise, that's a larger problem too. Does that make sense?
Thank you very much for your time. We better wrap it up.
Yeah,
but that was great. And you should talk to I think they've got a sign-up desk for the patients being involved in research.
Yeah, I was at that workshop.
Have a chat to them as well. This is a really important issue. And thank you for bringing it to light here at Medicine.
Well, thank you, because I was afraid no one would be interested in stats.
No, we're all interested in the numbers.
Okay.
Yeah,
Thank
as
you
long as
so
you don't
much.
ask us too many technical questions, because then we'll show our own illiteracy.
Thank you. And thank you, Aussies.
No worries, no problems. Okay.
Thank you.
Thank you, everybody. Great talk.